Is it dehydration? Is it her bowels that are causing an issue to heaviness or pressure? How do you actually poo properly? All these hot topics that no one talks about. How do our hormones impact our vaginal health that causes pain with sex? Why is it that we're more at risk of UTIs as we get older? So all of these things are areas that I want to be able for people to access.
Welcome to another episode of the Create Your Kindspace podcast with me, your host, Caroline Laurenson. Create Your Kindspace is all about wellbeing and the different ways in which we care for ourselves and those around us. So right before the festive holidays, I caught up with Rosie Davie, a physiotherapist who traded the rugby field for a mission to transform women's healthcare. I think it's a topic that we don't talk about enough, and advice can often be unhelpful or outdated. So I'm delighted to have Rosie help shine a light on the issues and share her top tips and advice. So welcome to the show, Rosie. I am so glad to have you here, and we're going to be discussing a really important topic, but also a kind of sensitive topic, I guess, that a lot of people maybe don't like to talk about. But I think it is really important. So Rosie is joining us today to talk about all things pelvic health. And yeah, I'm just really interested to find out more about your background and also share some really crucially essential things that we should know about how to look after that aspect of our well-being. Because yeah, I was actually reflecting on this before and thinking it's almost a bit like, when you go to the dentist and they're like, oh, have you been flossing and all that? And you're like, not really. And it's something you should be doing. I think it's a really similar thing, isn't it? Where you're like, oh, I kind of know what I'm supposed to be doing, but you don't really pay it enough attention. So thank you so much for joining us.
Yeah, no, thanks so much for having me. I absolutely love any opportunity to speak about what I do for a job, and I think it can be a very taboo subject, like you said. And I think for many of us, walking around in general life, unless we've potentially gone through a pregnancy or a birth ourselves, pelvic health's not really spoken about much between those two time frames. And I just like to bust as many myths as possible and try and get females feeling as confident as possible. Because I think, yeah, like you said, it's like going to dentist and your teeth getting flossed, but there's also lots of things that we can start doing that probably we're already doing that we don't actually realize it can be such a good impact on our pelvic health as well for life. So yeah, so I think I like to make pelvic health easy. I like to make it simple, and I like to make it not added stress on the never ending list of things to do. I like life
Oh
to be,
yes, that is
yeah.
music to my ears. Yes.
Yes, I think because I've treated so many women over the years, hundreds, probably actually thousands now, and I think as females we've always got that overload in our brains of all things we keep in check of a house, and even if that's with children or not with children, or looking after parents or neighbours, or if it's jobs, or if it's looking after our partners sometimes, or looking after the dog, we always take on that mothering role of which we look after others quite a lot. And I think as females, I tend to see barriers being a big thing to why pelvic health isn't so good. So I like to try and make it as easy as possible so people can influence their own pelvic health practically
Oh,
and actually enjoyable, rather than being, oh no, I haven't done that, and added on the guilt trap of
yes.
yeah,
Oh, I love
stress.
that. Yeah, so we will definitely get into all the tips and things as we go through our chat, but maybe we could go back to, as a bit of an introduction, your background. So, how did you get into pelvic health physio? And maybe you can tell us a bit about your kind of journey into business as well as part of that.
Yeah. So I've been a physio now for over 12 years. But initially I was really interested in sports. I really wanted to work in professional sport. I did a lot of background in rugby was where my kind of like extra, I called it always an extra job. So I've always worked for the NHS, although after COVID I left. So now I don't. But when I worked for the NHS, I always had a bit of an extra side on business. I've always had this like itch where I want to do more, I want to learn more, I want to experience more. And for me, physio's always been a job that I've absolutely loved. I've never experienced a job where I've not enjoyed. I can't even imagine that. So for me, it's like I always want to be a better physio. So I joined my local rugby team and I was really lucky at that time because they were semi-professionals. So we covered a lot of the Glasgow Warriors, which is a kind of professional rugby team here in Glasgow, and then we got a lot of the Scottish rugby players down like post injury and things. So we worked at quite a high level. Anyway, there I learned that probably working the level of working pattern, shift pattern in professional sport maybe wasn't what I quite wanted. I'm a very
Uh,
sociable person. I like seeing my friends and family too much. And I actually found professional sport quite competitive to work in as well. And for me, I'm not really that kind of person that copes well with different strong personalities. So I actually moved away from professional sport, and it's so interesting now because I have done a 360, and I went into pelvic health through actually it was a I did a musculoskeletal post, which is where if you got a sore shoulder, a sore knee or a broken ankle, you would come to physio. So you'd walk in, you'd see a physio for an appointment, and then you would leave. So I worked in there for years, and a post came up to kind of cover maternity posts in pelvic health, and I was so keen, and everyone was like, "Why do you want to do that?" Like, because it's a taboo. Like even at university, none of us get taught about the pelvic floor. It's
oh,
like,
so,
ah,
so as a physio, that isn't one of the modules that
no,
you cover.
no, it's like this empty, and it's so interesting now looking back. It actually makes me quite angry, actually. When you look at skeletons, you look at anatomy posters, they give you a lot of like the muscle groups of the body, but there's this section of the pelvis that just is missing.
Oh,
Um, yeah, it's a strange. Maternity was an option in university, but you had to choose between maternity and sport. And most of us as physios see ourselves doing sport. So a lot of us chose sport. I don't think anyone even actually chose the maternity section. So I had no knowledge of it. And that for me is an issue because I felt if I'm treating females throughout my job, I want to know more about this space. So I
mm,
moved into it, and the physios that I worked with, I have such fond memories. They all became like basically the kind of mother hens of me being quite young, and it was quite a kind of older place to work. Like lots of physios wouldn't work in it unless maybe they'd had children themselves.
yeah,
Um, and I was really young. I was in my early 20s, so I hadn't had a family. I still haven't had a family now, but lots of physios go into it after having children. And I came from a very kind of sports background. Anyway, there was no career progression for me in Ayrshire and Arran, so I went to Glasgow for a senior pelvic health post after that. Never looked back. I've worked in all sections of pelvic health, like so the kind of older females to females having issues like prior to pregnancies, through pregnancies, and through postnatal periods as well. And I was really lucky in my post, particularly in Glasgow, that I covered all age ranges. So my job was great, and through this, patients began to ask me, do you not do anything outside the NHS? Do you not do any classes? Do you not do any teaching? Can we not see you privately? And I thought, oh, private, I don't even know where to start with a business. And how do you start a business? And what happens if it fails and doesn't do well? And what happens if it's not successful or does something wrong? You know?
mm,
And I dipped my toe in. I just went for it. And it got so busy. It got so busy that I was working probably an extra job on top of my full-time
wow.
um, physio job. I love to
So
work.
you're still working in the NHS and you
Oh
started
yeah,
that, yeah.
yes, full-time NHS and working Saturdays. I was covering the odd rugby game still as well on Saturdays. And then I was teaching through the week in the evenings and then starting a clinic, and the clinic became too busy. And my husband at the time, who was, my boyfriend, used to pick me up and drive me back home because it was so late. And I would start back at the NHS the next day. And from there, I just slowly reduced my hours in the NHS. And I always thought, I just can't do this full time as a business. Like, I won't be that popular. I won't be that busy. Um, this is a luxury people to pay for. And I can't believe where I'm at now. Like, I'm probably one of the probably the most but not busiest pelvic floor physios like in the west coast of Scotland. I'm so busy, and now the way that I've worked or the way where I'm at now, I've gone back into professional sports. I'm actually teaching the Scottish Rugby Union girls team before their Six Nations next year about pelvic health. So I've done a full 360 and I'm back into sport
Oh,
again. So yeah, that's a really long sentence, but I suppose that's my journey of where I'm at. And I'd never want to go back to men's sport now. I absolutely love treating females. I
that's amazing that you kind of
enjoy.
come back to that sport connection as
Yeah,
well.
yeah, yeah. I'm really passionate that everyone should be active. I think exercise is a huge part of my life. It's been a huge part of my being brought up and my relationships and my friends groups and people that I've been able to meet through sport. It connects us socially as well. And I think there's lots of challenges and barriers in females' lives to be active. It could be busyness, it could be time, it could be childcare, it can be pelvic floor symptoms that stop you from being active. So
Mm.
part of my job is to make sure that females are educated on the benefits of exercise. So yeah, it's kind of why I'm probably quite strong-minded in pelvic health, actually.
Yeah, it's so interesting because before I met you, I mean, I guess it was a bit of a revelation to realize that there are specialists in this area because I guess my experience has been like if you have any kind of an issue, like the first place you would go is your GP. You'd be lucky if you get 10 minutes with them, and you'd be lucky if you get basically like a pamphlet with like here's what you need to be doing, and there's never any follow up or anything like that or
Mm.
any like deeper investigation. And I know like in my experience, well, when I went to the doctors, it turned out it was a urinary issue, but they
Mhm.
had kept on telling me, go do pelvic floor exercises. And I kept going back and saying, this is not helping. Like, I need someone to actually like do some tests or like properly look at what's happening. But for such a long time, they made me feel like it was in my head a
Uh-huh.
little bit.
Yeah.
Yeah. And then you wonder why women don't talk about these things because quite often it's the medical professions, they don't really have that understanding of what's going
Oh,
on.
absolutely. And when we look at even the research, like it's only been till recently that females have been included in actually medical studies about about our bodies. So our hearts, our brains, our skin, our hormones regulate all of that. And as females, we are a bit more complex in the fact that our hormones change every week and then they change as we age. So it's been a long time that we actually haven't been included in research, and that's caused a bit of a misassociation between treating us like men when our bodies don't react the same way as men and females, and as healthcare providers or as personal trainers or anyone working with females should understand that hormones play a massive role in our whole system. And if people don't understand that, then they don't have a grasp of how to treat a female. And I think just like you said, like GPs, I always say are general practitioners. So I think they are there for general ailments, general complaints. But I'm really lucky to be a specialist in pelvic health. And when I say pelvic health, a lot of people associate that with Kegels or pelvic floor exercises. That's kind of part of my job. I'd probably say it's maybe 5%. Um, a lot of it's looking at your full system, like how's your hormones, like screening you for perimenopause, screening your mental health, screening you for any sexual dysfunction that you have, any
Mm.
bowel dysfunction, your nutrition, your eating habits, your stress habits, your movement habits, everything. And then it's making a plan if it's an individual plan. And I think that's where general practitioners struggle because they don't have the time. And they also just don't have the understanding. And actually, menopause is not really a subject in which it's taught to doctors. So then we have a huge problem there because I've had women who have had like terrible migraines start in their 40s, sending them for brain scans, sending them for tests, really increasing their anxiety. And actually, a lot of it's to do with estrogen and menopause and perimenopause. And actually, if we knew more or if we were better educated around that subject, we could treat that patient a lot quicker, a lot more with reassurance.
Mm.
And she probably has anxiety already because if her hormones are changing, and that will affect loads of things. So yeah, I think for me, in the ideal world, I don't think this will ever happen. One of me will be in your GP practice. So you will not see your GP for bladder ailments, for bowel ailments, for pelvic floor symptoms, for postnatal checkups, for pregnancy well-being things. It will all come to pelvic floor physio, and we can get specialist training to prescribe medication, to fit pessaries, which we can talk about, and do things to support our clients. So then we take our really good knowledge we already have, we make us even better, and then that patient gets a really good treatment plan when they come to see us. And we know straight away if you need to go to urogyn, or you have to go to urology, or you have to get a scan of your bladder, or
Yeah.
antibiotics. Like we can easily know that by just chatting to you. So
Yeah, so the referral process is a lot more
smoother.
straightforward because
Yeah.
yeah, for me it just went on for such a long time,
Um,
and then when I did actually go to see the consultant at the hospital, I was like, oh my God, I'm not crazy. There is actually
yeah.
something wrong with my bladder and stuff. So yeah, it just yeah, I think
And that's
for me it was a revelation to realize that actually in a health setting, like in that kind of first touch point, that there's people like you that can kind of help guide you through that process
yeah,
because it's
totally.
emotional as well. Like it
Yeah,
caused me a lot of stress.
yeah. And I think the health gap, the gender health gap is absolutely massive. Like it has been proven by research that a woman might take a few visits to her GP to get the right outcome. Whereas if a male was to present, that they would get an outcome done that day. They get
Mm,
referred a lot more easily. But then if we also look at the recent report of gynecology waiting lists, what is it? It could film 8 times Wembley currently, the waiting lists of females waiting for gynecology appointments. Are we meeting barriers to referrals because our GPs are kind of subconsciously thinking, if I refer her, it's going to take 3 years, you know?
mm,
So are they kind of hoping that things disappear? Are they hoping things just get better? Um, so yeah, there's a lot of the whole system needs shaking up. This is really why I left. um, the system doesn't really support the proactiveness of health. Our system is a reactive system, so
yeah.
it solves a problem when it's there, kind of.
Or when it's escalated to the point
Yeah,
where it has to be
yes,
solved.
yes. And it's causing that person medical trauma
Yeah.
because they haven't been listened to, they haven't been heard, and they feel that they're like making it up, and they feel that they're losing their marbles. So, and as females and in pelvic health, that is so apparent, especially. And then sometimes we can be missed, like almost overdiagnosed in pelvic health, with certain things that can happen to your body. Like words like diastasis, like that muscle separation you can get.
Oh, I had that. Yeah. Gosh, that
Yeah,
my stomach was like the weirdest shape
yeah.
ever, the
So you get,
coning kind
yeah,
of shape. Yeah.
yeah, and that's actually a normal thing. Like that's happens to everyone in pregnancy, but we like to overdiagnose sometimes and then make females especially very fearful of their bodies, where actually we know it's not a weakness, it's not an injury as such. Um, but then there's lots of miscommunication, and then people get told not to exercise and not to lift the baby and not to do heavy lifting, and watch their posture and watch how they're standing, and it's like females don't need any added stress at a time that life's already quite hectic, especially with a newborn baby. We have to understand that actually, no, this can be treated later on, or actually, this is okay. This will resolve itself in 6 months, or it might not, but it's actually okay to have. Yeah, there's a lot of me reassuring women in clinic.
Yeah, yeah. That totally makes sense. Yeah, because mine, I guess I was a bit worried about it, but then I kind of knew that it would resolve itself eventually.
Mhm.
Um, but yeah, I guess, I mean, especially if it's your first pregnancy, it can be really stressful if
Oh,
and especially if you've not had any
yeah.
kind of uh, prenatal support to kind of understand like how your body's going to change and what that might mean for
Yeah.
the postnatal period.
And there's none of that. There's not really, unless you do maybe a class, but I don't think any antenatal education really talks about our job, and what we can bring. I don't think your body's really talked about in any way of how a pregnancy will change your body and what scope of difference might you have after a pregnancy. And that's where the issues are. And that's why I wish there was more proactivity in it, because if women knew more before it happened, we could be like, oh, this is okay. Like, this might change in a few months. I can control these parts. I can't control these parts. Or I can go here or I can go there for support. I think at a time that our mental health is really highly anxious, we're an extremely big group to market to as well. So people
Mm,
like market products to us, because we're vulnerable, and because they know the waiting times are so big, and because they know the gender health gap is so large. Businesses like those margins because it means then their customer is looking for a solution quite quickly. And that's where I also get quite angry, because sometimes their solution, their problem that they have in their mind isn't actually anything to worry about.
yeah, gosh, you've raised a really good point there about that kind of vulnerability around when we go through these big life changes, and you can see it happening as well with all the menopause stuff as well, and
Yes.
how that's. I mean, to be fair, actually, it's good that the issue's been raised and now
Mhm.
everyone's talking about it a bit more, and helping to like put pressure on the systems that need to help us to better understand women's bodies, from a medical side.
Mhm.
But then, yeah, we have like the commercial side where they
Mhm.
are, you can see that marketing is starting to kind of prey on that.
Oh, yeah.
Oh God, the amount of what is it I see all the time on my feed, it's like, oh, have you got a menopause belly? That's what you see, isn't it? And then it's
Oh, really?
like, here's this. I'm like in my 40s now, so so
It's
this
all
is what
it's
I
all coming up.
This is what I see on my feed. And yeah, it's like,
Yeah.
oh, here's this magic solution that's going to get rid of your
Um,
menopause
oh,
belly. And
here's
I'm
your
like, my
certain
belly's fine.
exercises. Yeah. This is normal. This is like okay. This doesn't
Yeah.
have to change. Yeah, do you know what? I did a course update. There's an amazing lady that lives in Australia that works as non-clinical now. She takes all the research from the whole of the year, maybe actually the past 2 years, and then she does an educational course with all of us, not all of us, but those who pay for her to do that. So it means that my research up to date is very, very good. So I get a yearly update on all the research, what's coming through, what do we past think, what do we think now, what are we seeing, what do we still not know about, just so I can really, really keep my skills and my clinic as best as it possibly can for the person that I'm treating. I'm very passionate. If people are paying money for a service, it needs to be really good. That's one thing that I'm really headstrong about. It was this slide that she put up, and it was talking about a female's body, of how we go from a baby right the way up until we're 100, roughly speaking, right? 105, I'll say 105. And it shows how our bodies adapt through life for certain age-related changes. So when we're babies, we go to toddlers. When we're toddlers, we get this transition of hormone changes, and then soon we kind of by our kind of early teenage years, we then come into like puberty. Puberty changes our body, and then we move into this teenage years and into like young adolescence where our body's still adapting and we're learning about, how our bodies are different. And then comes then pregnancy, and then comes this postnatal transition, and then comes this perimenopause transition, and then comes the postmenopause transition, and then comes 30, 35, 40 years postmenopause bodies. And as females, it's weird, a lot of us don't question the puberty transition. Like, oh, this just happens. Like, we have breasts, our hips get a bit wider, we go kind of body hair, our periods arrive, even though some of us don't question that quite a lot if you play sport. And then you get into postnatal and you're like, oh, what does this mean? Like, I've got a prolapse, or I've got my boobs have changed, or my skin's changing, or my tummy looks really squidgy and round, and we really quickly want to change our bodies at postnatal. And what I'm trying to encourage patients to understand and almost have some acceptance over is our bodies are made to change. They're
Yeah.
made to adapt and change with our life and where we are at certain stages. And some of that shouldn't be scary. Um, and I think as females in particular, we have a hard concept of body changing. And that's also part of the reason probably why I'm quite passionate in working in pelvic health, for my own struggles with body image and things like that growing up. And I think that really, I've spent so much time with females in clinic now that I have absolutely no issues with myself now, because I hear what females say about themselves on a daily basis.
Yeah.
And it's almost like crazy that people even have those thoughts. So I'm really trying to kind of educate on normal change, you know. And if you look how you did prior to pregnancy, postnatally, that's usually genetics. That's usually nothing that you're doing exercise wise or these core rehab things, or that's just plainly genetics. Um,
Yeah, so there's actually not as much, you can't influence it as much as you might think. Yeah, it's just that the body's kind of naturally going to go at the pace that it needs to go at
yeah,
to get
yeah,
to kind of recovery.
absolutely. Yeah.
Yeah, gosh, it's so interesting because I feel like your job, you've got this unique opportunity to kind of not just support on the health side, but also more holistically with that kind of mental health side as
Oh, yeah.
well. So I just think it's so interesting the way you've described that and how you kind of help women on that journey because we don't get the education that we need when we're younger. Like
Mhm.
literally, like you spend so much time in school learning about how our bodies are going to change, and then if you fall pregnant, usually you'll get some kind of support with a antenatal group or something like
Yeah.
that, or you'll at least have some support from a midwife who's obviously specialist. And then it comes to this kind of later stage, and like you don't
Yeah.
get anything. You get the pamphlet, or you get told to do pelvic floor exercises, and
Yeah.
that, from what you have just said, is like the
Uh,
tiniest piece of this puzzle.
yeah. And we have to understand, like, the pelvic floor, it's a really important muscle, I'm not going to lie, but I think we misunderstand why it's important. I think for a lot of us, we don't get taught where it is. We don't get taught how to exercise it. We don't understand if our muscles are a little bit tight in comparison to too weak. Um, I don't think we'll ever have a total list for someone to self-diagnose. I always think coming to see a pelvic floor physio, like we can really assess you and really get to understand what your risk factors are or of your tissues by assessing you. But I think the research and evidence really comes and says that being taught pelvic floor exercises should happen from a one-to-one physiotherapy and patient treatment. And what we're not matching up with that is we're giving people leaflets. We're giving people, even reading that, like, does someone understand where their pelvic floor is? Do they
Mm.
understand that there's 3 holes in that area? Do they understand where those 3 holes are? What they actually do? Um, because some patients of mine in the NHS didn't actually know that that was even their structure or how they were made. Do we actually understand what differences between the vulval area and the vagina? No, a lot of us don't. A lot of us just call it our vagina, and that's
Yeah,
actually
the whole thing is just
terminology. Yeah, because females should know exactly where they're sore, or be able to locate and talk to a healthcare professional and be able to actually see the words of her anatomy so she can get the best care and treatment. Whereas a lot of us don't understand. We just see this general area, which does make my job a bit of an investigatory sometimes. Um, but yeah, I think for a lot of us that baseline education is not there. And then when we go through a pregnancy, it's a lot to do with the baby. You know, the baby's feeding, the baby's burping, the baby's changing nappy, the baby's sleeping schedule, the baby's growth markers, the baby's development. You know, the baby's sitting up now they're crawling. And that's lovely. But babies don't thrive unless the mother's thriving. And and we do know from the point of view of postnatal depression, a lot of that can happen through birth trauma, a lot of that can happen
mm,
through their bodies changing, a lot of not exercising because they can't, because their body's
yeah,
not
because you're
allowing them to do
tired as
these
well.
things.
Yeah.
Yeah, absolutely. Um, Understanding how exercise can differentiate between different levels of your life as well, because a lot of us are made to exercise for aesthetics, I think, being younger. That was ever my role, was always team sports. I was really, really lucky. But a lot of females see exercise as aesthetics. Like my friends would say, "Oh, I've got the wedding soon. Yeah, I've been running loads, I've been walking loads, I've been going to the
Yeah.
gym." And
They've
I'm
got a
like,
deadline.
yeah, and I'm like, that should be a regular thing. Anyway, and then we go through this perimenopause and no one even talks to us. And that's the most stressful time of our lives, isn't it? Because we'll have elderly parents, we'll
Hmm.
have maybe teenage children that are going through their own hormonal changes.
Joy, joy.
Yeah, I mentioned that really lightly. And maybe our careers have got to a stage where we're balancing a lot. Maybe we employ staff, maybe we're quite high up, maybe we're in the corporate area. Um, so we're taking on more responsibility at work. And then no one ever assesses anything to do with our minds, our ability to cope with all of that, when our hormones are starting to decline at a rate which are not supporting our life, which then causes problems of stress, anxiety, leaving jobs, being unable to cope with the work demand, bladders causing havoc, being unable to have a sexual relationship with your partner,
Mm.
um, you know, and then feeling like you're failing in some way and going mental, like you just said, when actually a lot of it could be helped by just having someone sit there and talk you through all these things and ask you all these things. Yeah, I've had so many
Yeah.
people. Yeah, one lady, she was 35, going into early perimenopause, and she'd left her job as a head teacher. So she was a mum of a 5-year-old. She was leaving her job as a head teacher. Her sex life was changing. She couldn't run anymore because her bladder was causing her to need to pee all the time. So she stopped running because, again, she thought that was a bad, from pregnancy and hearing about pelvic floor, she kind of knew some understanding that isn't normal. So she stopped
Yeah.
running. And then she wasn't coping because exercise wasn't there. Her relationship was changing because she couldn't have intercourse. Well, because that was important for her and her husband. And then her job was really stressful. So she left a job in which she'd worked really hard to get to that position and probably was the right person for it,
Hmm.
but and not one person over that journey of signing her off work, of giving her antidepressants, um, not one person asked her about her hormones.
Yeah.
And
Or yeah,
when
to
her
find
mum
out
went
the root
into,
cause.
yeah,
Yeah.
just gave her antidepressants and said, yeah, it's stress.
I bet
Women
that
get
happens to
told,
a lot of
yeah,
women.
women get told we're stressed a lot. Uh, you know, you're really stressed.
Oh,
Um,
take a day off.
yeah, yeah, go for a spa. Yeah, I think as women we're actually really resilient and we can multifunction in high stress environments. It's what we see with businesses running on female
Mhm.
grounds. You know, we see a lot of profit and a lot of success of businesses under female. So yeah, I question if a lot of it is stress. I think a lot of it's not us not being heard.
Gosh, yeah,
But
that is, yeah, absolutely 100%. Yeah.
so I think what makes probably my clinic quite special is probably the fact that I treat patients very holistically. Like, I want to know all about their life. I want to know about their partners. I want to know about their children. I want to know about their house, where they live, what their work's life, what their work-life balance is like, what their relatives are like, their family support's like. I want to know about everything about their whole environment, because that really influences how I treat that person. Physio should be supportive, it shouldn't be demanding, and it shouldn't be that I'm the ruler over your body. I should like facilitate your own change to happen, you know. And
Yeah.
sometimes it's getting to understand and listen. You know, a lot of physios don't actually listen to people. Medical professionals are not very good at listening. Usually patients know what's wrong with them. Like for your example, you know,
Yeah. I
you,
kept
you
going back and I'm like, this is not the
yeah,
problem. Please do some
like
other tests.
yeah, like I am the living experience. I am feeling this in my body. No, 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 just
Yeah.
go away and do this. You know, that's not listening to someone. So actually, a lot of my patients do tell me their own rehab or what they have to do when I talk to them. They already know. It's just sometimes a bit of encouragement, a bit of a holding hand of how to
Mhm.
add that into their life, a bit of a stepping guide of what to do first. And they can choose maybe what to do first, you know. Is it drinking more water? Is it taking 5 minutes out of your day of sitting down to move your standing desk up? Is it to get off of your chair and just do 10 squats? Is it to have a commute where you're walking to work a little bit rather than constantly driving or taking the train? Um, is it that you have to begin to exercise again and load your body and add some resistance? How does
Yeah.
that look for you? So my clinic tries to aim to support women at any point they're in of their life, not when it's the right time. Because I don't think it's never been the right time. We're always going to have things that make us busy or that are more important than us. And that's the problem I have because as we get older, our pelvic health starts to get a little bit harder to treat. We can still access the care and we can still get better, but if we're past the age of 60s, 70s, we're lacking in vaginal estrogen for the last 15 years, and we've not exercised because we got told that leaking with exercise is really dangerous. We've got a prolapse and we should not lift weights. When I'm meeting you in your 60s and you're not on estrogen yet, you aren't taking any vaginal estrogen, and there's a lot of deconditioning, it is going to be a hard journey to build that
Yeah.
bridge, build you back up again, So I like women to get in early. I like women to get a checkup, as soon as they possibly can, like in their 40s or 30s, if that's the right time for them. And then they have those skill sets and the knowledge to take them into their 60s and 70s.
Gosh, wouldn't it
That's
be amazing if we all
yeah.
got checkups?
Oh, so
Oh,
nice.
yeah.
Honestly, it is right now. It's a big privilege to be able to come in to see a pelt for physio privately. I understand that. It's quite expensive physio appointment as well because a lot of us are really highly skilled. I'm not saying MSK physios aren't, but there's a lot of things we have to know about that makes us almost like a combined physio of everything.
Yeah.
Um, and then we sometimes though what I like is if someone can afford one appointment, I like to try and give them little nuggets away to try and think about, okay, in 6 months' time, if you add this in, and then in a year's time, aim for this, and if you carry these things on right into, you'll come off and on, depending on what life's throwing at you, but you need to get back on track again. Um, and then, by the time they're 60, they're actually healthier as a person.
Yeah, and
Um,
you've got that resilience as well. Yeah,
yeah,
and just armed
totally.
with that little bit of knowledge and reassurance. Yeah,
Yeah, absolutely. I think it's a really special place to work. I think I'm really lucky. And I think only thing that frustrates me is there isn't enough of us. It's not a, shall we say, I don't know, can we call it a sexy place to work? It's professional sport, I think still eats the biscuit slightly, but I think it's coming a hot topic. I think young physios now are, they're reaching out to me and they'll be like, how did you get into pelvic health? What's your background? How did you get trained in this area? People are more interested in it, but I want to make sure physios are interested for the right reasons and not interested because it's a lucrative place to work sometimes because there isn't a lot of us and the
yeah,
waiting lists are really long and large. It's also a very, very heavy place to work, sometimes emotionally as well. And you need to be aware of all the things that you'll face in that career to make sure it's the right career choice for you
yeah.
as
Because the
well.
people that you're supporting, they could have been through different traumas and things that have impacted
Yeah,
them. That
yeah.
yeah, that and they'll maybe be opening up to you for the first time. Like they'll be opening
Oh,
up, and that yeah, that can be a lot to take
yeah.
on.
A lot of you realize how much negligence there is sometimes in the care system, slightly, how much it's not proactive and how much it is reactive. And with maternity reports coming out these days, then it's kind of a shining a light on some of the trauma, the post-birth trauma, PTSD diagnosis, postnatal depression rates that I'll see in
Yeah.
clinic, which is really, it's so sad. And I think people have to be very aware that you are sometimes a huge anchor for patients. So, for example, me and my husband went to the gym this morning, and I had two individual patients calling my name across the gym and running over to speak to me. Like you become like one of their really good friends,
Yeah.
um, because they've given you some of their darkest secrets or their most intimate problems, and you've treated them and made them feel so at ease and so comfortable that sometimes you can, as healthcare professionals working in the space, and there being long gynecology waiting lists, you can get quite a lot of people contacting you and desperate to get in to clinic.
Hmm.
I find that really challenging.
Yeah, I can
I find it,
imagine.
yeah, I find it really hard to be like, I'm full until January. I'm sorry. Like, I just, yeah, I struggle so much with that. But that's something that I've had to get used to being the receptionist. Whereas before in the NHS, I would just get my list. I wouldn't have to talk to him on the phone. I wouldn't have to, respond to anyone being upset or crying down the phone at you. I wouldn't have to so it just shows you that the lack of support there is really
Yeah. Well, I'm so
sometimes.
glad that you have gone on this path because it sounds like it's definitely needed. One thing that we talked about before was I guess, your ambitions for the future and how you might be able to kind of scale this and grow what you do so that you can help
Yeah,
more people. So I don't know if you can kind of share like any plans or like little seeds
yeah.
of like what you're working on.
My brain is constantly dancing with ideas. So I think, yeah, I actually say now that I own a business now, and that's taken me a long time to say that. And this year has been quite a journey of trying to scale something for different reasons. One, because I do get a lot of patient flow to my website and there's only me. So I tried this year to employ other physios. I tried to build a clinic in different areas of Scotland, so one being Glasgow and one being Ayr. And then I began to do pop-up clinics around Scotland in Campbelltown and Islay, which I absolutely loved. But then my husband,
Yeah, so more of the rural
yeah,
areas. Yeah,
yeah, my husband likes to remind me that I only have one body and one mind and one space for so many people. I like to try and treat everyone. So where does my passions lie? My passion lies from having access to evidence-based care, from being able to bring me into some sort of virtual capacity. So I'm next year I'm launching small modules. I think I'm going to call it pelvic health with Rosie. That is in the kind of boundaries just now, but and it's on Teachable platforms, so
yeah,
people can find it on my website as well. But the first care package I'll be looking into are C-sections. So how do we prepare for elective C-section surgery? How do we recover from having a C-section, and what does that scar mean for our body?
yeah,
And how do we regain strength in those areas post C-section? So that'll be the first launch. And then I'll be looking at kind of adding different little courses on so people can have access to pelvic health physio from me anywhere, especially in Scotland. Yeah, I'd love to help more mums that, you know, can't access anyone, probably even physio, because they stay too rural,
yeah,
or pelvic floor physio. They're like, what is that? Like, I've never heard of that in my life. My GP's never mentioned that, and that's probably because they don't have a pelvic floor physio locally.
yeah,
So that's what I'm working on just now, is building some sort of online presence where I don't think it will replace me in person, and it shouldn't do that, but it will give someone enough information that she can start to abolish worries, make a plan, and be able to actually work out exactly what's driving some of her symptoms. Is it dehydration? Is it her bowels that are causing an issue, to heaviness or pressure? How do you actually poo properly? All these hot topics that no one talks about. How do our hormones impact our vaginal health that causes pain with sex? Why is it that we're more at risk of UTIs as we get older?
mm,
So all of these things are areas that I want to be able for people to access, financially cost effective, easy to listen to. It's not overwhelming. It's small, bite-sized information videos. You can come back to it whenever you want. You can listen in your headphones like a podcast. So the online platform will have options for all women to be able to learn. And then from there, what I hope that will give people is empowerment to go to their GP and be like, I started doing this, this, and this. This is improved. This is still there. I know what that is. It's hurting here. I want to go and see a pelvic floor physio. Or it gives people the education of being like, pelvic floor physio is quite a cool place to go. They're not going to be people that tell me to stop exercising or stop doing what I love. There are people that support me and facilitate me, and I want to go and see one privately.
yeah,
Or it might encourage people to book online with me, and then I can see them virtually, and I can see them kind of like in my virtual clinic, basically. But I do have some ladies who travel from Manchester up to Glasgow to see me,
wow,
and Skye. Skye and Manchester are probably my furthest travelled. I've seen two ladies in Amsterdam virtually, as well. So I think access to pelvic health can be virtual and in person. So yeah, just growing that part of the business, I think for me is the next step, because definitely not being a manager, not having staff, and not having loads of premises is definitely better for me. I've worked out this year.
yeah. You've been through quite a year, haven't you? You know,
Yeah, it's
expanding
been
and contracting and, learning all those
yeah,
lessons.
and
Yeah,
getting tugged, and trying to sense which way to get tugged, when actually it's so hard because you just want to help people.
yeah,
And when that's not happening because you're getting distracted by other things, or they aren't, maybe the help's not the thing that you would have, liked to have happened, it gets really difficult. And I think for me, that involves around me being my own clinician, running my own business, and then me trying to educate outside of that as much as possible. Um, so that's what 2025 brings.
Nice. I feel like in terms of scalability and being able to, yeah, help as many people as possible, an online platform and using, something that's readily available, like a teachable type platform
Yes.
is a really smart way to go.
Yeah.
And I cannot wait to see all of the content because yeah, we need Rosie in our lives.
Hopefully people all feel the same, Caroline. It's a strange concept making yourself accessible everywhere on people's screens. It's so funny. But again, as we were talking about earlier, it's that imposter syndrome that a lot of us have when we're running businesses and when we want to do a good job. It's like new mums that say to me, they panic over certain things or they worry quite a lot about being a good mum. And I say to them, well, you wouldn't be a good mum if you weren't worrying. So it's like
Yeah, it's
that
natural.
imposter syndrome, it's like you worry that you aren't doing the best job, but actually what you are providing is what people need.
Yeah, absolutely. I think anybody would be lucky to have you supporting and guiding them. So thank you so much.
Thank you.
Gosh, the time just disappears
I
on
know.
these interviews sometimes. It's just so lovely to have you. So before I let you away, there's a couple of things that I always like to ask my guests. So when it comes to the kind of Rosie behind the scenes, what are the things that you gravitate to when you're feeling like out of balance or maybe a little bit stressed?
Mhm.
How do you create your kind space?
Yeah, I think this year it's been a massive learning curve of facilitating my own kind space. I think the gym's a massive one for me. Movement. And sometimes what I like to do, because an hour's gym session can't always happen every day, depending on how work's been or how demanding certain clinical lists are. So what I have done, rather than give myself a hard time over that, um, I'll literally just get off my chair and I'll do a ritual of like downward dogs, like some body weight squats, some lots of thoracic rotations, and then I've moved. So rather than saying exercise now, I've replaced the word exercise with movement. I'm like, what movement have I done today? And has that felt like the right movement for me? So that's a big one. My other one, which is so funny, I wouldn't have said this when he was a puppy, but is our rescue dog, Benji. He's like I can totally see how people say like therapy dogs or
Oh yeah.
it's like he smells amazing. He's got the most amazing manner. He absolutely loves me and my husband. Um, and yeah, he's definitely a big part of that, I think. And the other part is probably my cheerlead group, I suppose. My husband, like my friends, family, surrounding myself with people. I tend to go to Ayr sometimes if I want to get out of Glasgow, just the beach,
Yeah.
open space, yeah, fresh air, a nice glass of wine occasionally. I don't know if I should be promoting that for my mental
I think
health.
that's okay.
But yeah, those are the things that I like to do. And I think this year it did get to the stage where I was struggling to fit those things in because of how much I had on my plate. So I've
Mm.
seen what life's like without fitting our own our own oil in. And then soon that oil begins to burn out, So
Yeah.
I think that's a really important aspect moving into 2025 that I'm really going to focus on. And sometimes it's just breathing, like just sitting there and just taking these massive big breaths and like sighing everything out. Yeah.
Yeah, instead of like feeling like go, go, go all the time, like,
Yeah.
oh,
Go
I have to
slow.
get all these things
Go
ticked off
slow.
my to-do list.
Yeah, go slow. I'm slowing right down. I had the whole world in my ears at the start of this year. I was going to grow. I was going to get bigger. I was going to, treat help for more women, and but actually, I can only do what I can do, and I need to slow down. So I'm there to support more women to come because it got to the stage this year that I almost stopped the business. I was like, this isn't healthy for me. Like I can't sustain this. And I think 2025 is going to be about going at my own pace and just not having any date set or, you know, until I'm happy with that product, and then I'll launch it. I'm not going to be having um, these big flags waiting for me to cross finish line at certain times, because things happen in life and you can't control when sometimes stress hits you, and you
Yeah,
have to have the capacity to deal with unwanted things that happen throughout the year. So yeah, that's a
that's a
big
really
space.
that's a really good perspective to have. Yeah, and I feel like you've got a really nice blend of things that you can, tools in your toolbox that you can kind of call upon when you need that support. So that is so good.
Absolutely,
Oh,
absolutely. Thanks so much for having me, Caroline. I feel as if we've just like had a conversation over a cup of coffee rather than
that's
anything.
exactly the vibe that we're going for. So that's good. And very last couple of questions is if
Mhm.
people are wanting to find you online and connect with you and find out more about their pelvic health, where should they look?
Yeah, so at the moment, I've got 3 areas, which probably doesn't help people, but I've got Instagram, if those that use it. It's just Rosie Davie physiotherapy. If you just type that in, it will come up really easily to find me. And the other thing is the website, which is rosiedaviephysiotherapy.com. So it's just my name plus the physiotherapy word. And then the Teachables is on the website. So my online, so far I've got pregnancy education on there and postnatal rehab on there, and a bunch of movement, like almost like strength Pilates movement videos for women to access anytime to like keep
Oh,
themselves
cool.
moving, yeah, and exercising. And there's some pelvic health education in all of them, obviously. Yeah, those are the kind of 3 main ones that I've got, but the website probably has everything from there as well. And if anyone, I'm happy to, if anyone wants to email and things like that, I am good at getting back to people throughout a couple of weeks' time. And if looking for pelvic floor physios closer to them, I am quite good at kind of recommending people, because we've got a big POGP chat on my phone where all our pelvic floor physios gather, so I
Oh,
can
cool.
ask for recommendations if anyone
Yeah.
else is looking for a bit further afield. But obviously, I love to treat as many people as I possibly can on my own weird way of treating, this very holistic way. So yeah, but that's where most people will kind of find me.
Yeah, so we'll pop the links into the show notes as well so everyone's
Thank you.
got it. But thank you so much for being such a beautiful guest. And
All right.
yeah,
Thank
I
you.
hope we'll catch up again soon.
Yes, thank you so much. Thanks for having me.
I'm sure I'm not the only one after this discussion feeling empowered that our pelvic symptoms are not just something that we have to put up with as women. Yes, our bodies go through significant changes through pregnancy, motherhood, and beyond into the transition to menopause. And these changes, they are natural, but there are also proactive and holistic approaches that can help us to improve how we feel and also allow us to still do the things that we love. I think the call to action here is to prioritise our pelvic health, and if we're not getting the answers we need, seek out specialist support from someone like Rosie. Thank you so much for listening all the way to the end. Before you go, I have a little favour to ask. So if you've liked this episode, please screenshot it, tag us on social media at Create Your Kindspace, and maybe share what your key takeaway was from the episode. It would also be so wonderful if you could rate and review this podcast, as it helps other people to find it. Thank you so much.
Anyway,